Hi everybody, it's Tamara Russell here. Yesterday we were working with the body and mind training teachers in training, brave warriors from Brazil who have been embarking on the body and mind teacher training program. And yesterday's topic was compassion. It's clear from much of the research now that changes in self-compassion particularly seem to lie at the heart of many of the benefits that we observe with mindfulness training. Many people misunderstand mindfulness training as being about training in attention, about training in being in the present moment. But a very critical part of the mindfulness experience is the ability to cultivate a non-judgmental attitude. And when we say these words, be kind, be non-judgmental, be compassionate, it sometimes sounds quite easy, and maybe for some of you it is really easy. But in my experience, when we're working with BMT and we get to the final session on compassion, there's actually often some surprises that the students and the teachers in training stumble across, particularly when it comes to self-compassion. I work a lot with healthcare workers and medical professionals, and many of them are hugely compassionate to others, but they really struggle when it comes to self-care and being kind to themselves. In the medical community particularly, we know that there's high levels of perfectionist traits. And in many ways, these are traits that make these people great healthcare workers. They don't like to make mistakes, and they hold themselves to very high standards. But there's a flip side to that, which is that they can be very harsh on themselves, and in moments perhaps where they need care and kindness and to be good enough rather than perfect, they really struggle. And given the imperfections and limitations of our current healthcare systems, the opportunities for many of these professionals to do their best work can be limited by factors that are outside of them and nothing to do with themselves. So this can lead to burnout, compassion fatigue, all sorts of psychological distress that ultimately means that neither the healthcare worker nor the person they're trying to care for get the best out of the experience. So this topic of self-compassion particularly is quite tricky. Our understanding of what that means is often influenced by the tribes and the cultures in which we grew up. That includes family culture, educational culture, professional cultures where we've done our training. And that would be my top tip for you if you want to dive into self-compassion as a practice, is to take some time to understand how your brain's neural networks have been conditioned around this topic and understanding of self-compassion. So you might even just make a quick chart now, writing down what was the family story or narrative around self-compassion, perhaps as distinct to compassion for others. What was the family story around that? Self-care, being kind to ourselves. Was it something that was encouraged and nurtured, or perhaps was it something that was seen as a bit self-indulgent or not necessary? Then you might consider in your education system or during your formative years, perhaps those teenage years, where were you? What culture or tribe were you in? And how did that culture or tribe shape those teenage neural networks that are undergoing huge transformative process due to the hormones? How was your understanding of self-care and self-compassion shaped in that moment by those around you, your peers? We know that in the teenage years, the importance of peer feedback and peer approval becomes much more important than anything a parent can say. So how did that community shape your understanding of self-compassion? And then finally, for those of you out there who are adults, what about your professional training? Perhaps your graduate or your postgraduate education, training, and culture. Maybe you're working in the healthcare setting, or perhaps you're working in a business setting or an education setting. How has your time and experience there shaped your understanding of self-compassion and self-care and what it means to be kind to yourself? Are there positive beliefs and experiences in that setting where self-care has been allowed, discussed, permitted, had space made for it, perhaps by those in leadership? Or maybe you've had a different experience. Perhaps it's not even on the table or in the conversation. What is self-compassion in the workplace for a nurse or a doctor, a manager? And for those of you that maybe are in positions of power, which means a position perhaps where you're responsible to others or accountable to others for your behavior, we know from the literature that one of the most powerful training tools is modeling, letting others see what you are doing so they have a model or a scaffold for that behavior and they know that there's permission for that behavior. And once I worked on a project around mindfulness and self-care for GPs, and one of the GPs was a mum. And in the course of opening a dialogue similar to this one, as she was reflecting, she basically said, I don't think my children have ever seen me doing self-care or being compassionate to myself. And the reason for that was something very understandable. She was a mom, she was a busy GP, she was working non-stop when she wasn't working with her patients and managing her practice. She was doing things for the kids. And so she recognized and realized that her children had never seen a model in the family of what it means to say, no, stop, I need some recovery time. I need to do something that allows me to soothe, to fill up my energy tank, not just to be giving, giving, giving. And so she really recognized that perhaps there was a disservice to her kids who were not seeing in the adults in their world around them that it was okay to be kind. It's okay to take a pause. It's okay to have boundaries and say to someone, I can't do this for you right now because my tank is getting really empty. And in order for me to really be there for you, I want to be resourced. I want to be well. I want to be clear thinking. And actually, it's a service to me and you when I do something for myself around self-compassion. Now, often that busy monkey mind comes and says, but other people need me, but other people's need is more than mine, but I can't just say no. And some of that may be true. Some of that may be true depending on your circumstance. But I can pretty much guarantee that that's not true 100% of the time. So that might be another review that you can do, really being honest with yourself about the times when that is true, when it really wouldn't be appropriate to say, no, stop, I need to fill my own tank up. But just challenge yourself a little bit to also reflect on where are moments where that reaction has become habitual And you do it without thinking, without checking, without even tuning in. Those are some of the places maybe where we've got some wiggle room. And then also that previous exercise to help you locate where your beliefs about what it means to be compassionate to yourself may have come from, because some of those may also be operating outside of awareness in those moments where you just keep going, you keep saying yes, and you're not able to say no. So those are some reflections on self-compassion. We know it's important. It's harder than it sounds. And when we try to be kind to ourselves in this way, we meet a whole host of developmental, historical, cultural, and embodied factors that get in the way. But I hope with this brain-wise and psychological approach, you may be able to start loosening up some of those neural networks where this conditioning is held, and find some ways in your own life where you can just sneak in a little bit of self-compassion in whatever way it shows up for you in your world. The practice I really like, which is pretty simple, it involves a hand, it involves having a heart to place it on, and it's just a moment where we make contact with our hand on our heart. Take a few breaths. And allow ourselves the opportunity to say, this is hard. This is hard what I'm facing right now. This is difficult. This is distress in my body and mind. This is hard. And perhaps feeling beneath the hand on the heart, the breath moving in and out of the body, the rise and fall of the rib cage. And if it feels helpful, maybe taking one or two slightly longer, slightly fuller breaths. And then just releasing the hand. So to be clear, this isn't about drowning in our distress and difficulties, but it's that really important first movement, which is to acknowledge them, to recognize them, and to acknowledge them. So I wish you well, and if you found this helpful, please do comment down below. I'd be interested to hear your experience. Thank you.